Good day, class. I welcome you all to this study session, which will discuss drug abuse and addiction. I'm very sure you will enjoy it. Just sit back and enjoy the lecture. Drug abuse, also called substance abuse or chemical abuse, is a disorder that is characterized by destructive pattern of using a substance that leads to significant problem or distress. Drug abuse affects more than 7% of people at some point in their lives. Teenagers are increasingly engaging in prescribing drug prescription that leads to drug abuse, particularly narcotics and stimulant medications, which treat conditions like attention deficit disorder and narcolepsy. In this study session, we shall discuss various issues relating to abuse and addiction, paying particular attention to the causes the substance commonly abused, recognition, effect on the sufferer, and possible treatments available. At the end of this study session, I expect you to be able to describe the various causes and risk factors for drug abuse and addiction. You should be able to explain the physical and psychological effect of drug abuse, diagnosis, and treatment, and should be able to discuss the complication and prognosis of this drug abuse. What are the causes and risk factors for drug abuse and addiction? Substance abuse or dependence unfortunately occurs quite commonly in people who also have severe mental illness. Individuals with dual diagnosis are also at higher risk of being non-compliant with treatment. Like the majority of other mental health problems, drug abuse and addiction have no single cause. Drug addiction, also called substance dependence or chemical dependency, is a disease that is characterized by a destructive pattern of drug abuse that leads to significant problems involving tolerance to or withdrawal from the substance, as well as other problems that use the substance that the use of the substance can cause for the sufferer, either socially or in terms of their work or school performance. The frequency to which substance abuse disorders occur within some families seems to be higher than could be explained by an addictive environment of the family. Therefore, most substance abuse professionals recognize a genetic aspect to the risk of drug addiction. Psychological associations with substance abuse or addiction include mood disorders like depression, anxiety, bipolar disorders, thought disorders like schizophrenia, as well as personality disorders like antisocial personality disorders. Aside genes that can cause that are risk factors for drug abuse and addiction, environment is also a risk factor. If you have a chaotic home and abuse, when the parents are using drugs and their attitude, then there's peer influences. It's a risk factor for drug abuse. The community attitude too can be a risk factor. Then poor school achievement can also be a risk factor for drug addiction and abuse. Now let's look at drugs that are commonly abused. The top most commonly abused drugs include alcohol, tobacco use, marijuana, painkillers, antidepressant drugs, cocaine, stimulant drugs, hallucinogens, heroin, and methamphetamine. And what are the signs and symptoms of drug abuse and addiction? This pattern is manifested by at least one of the following signs and symptoms in the same 1 year period. When you have recurrent drug use that results in a lack of meeting important obligations at school, work, or home. When there's recurrent drug use in situations that can be dangerous. When there's recurrent legal problems as a result of drug use and continued drug use despite continued or repeated social or relationship problems as a result of the drug effect. When a patient exhibits at least one of these signs, patient can be diagnosed of being abusing a drug or being addicted. Tolerance is either a markedly decreased effect of the substance or a need to significantly increase the amount of the substance used in order to achieve the same high or other desired effects. There can be withdrawal which is defined as either physical or psychological signs or symptoms which is consistent with withdrawal from a specific drug or taking that drug or one chemically close to that drug in order to avoid developing symptoms of withdrawal. Larger amounts of the drug are taken on for a longer than intended. Then the individual experiences a persistent desire to take the drug or as unsuccessful attempt to decrease or control the substance use. When significant amounts of time are spent getting or using or recovering from the effect of these substances, we can say the person has withdrawal symptoms. The individual significantly reduces or stops participating in important social, recreational, work or school activities as a result of using the substance. The individual continues to use the substance despite being aware that he or she suffers from ongoing or recurring physical or psychological problems that are caused or worsened by the use of the drugs. Now, let's look at physical and psychological effects of drug abuse and addiction. Psychologically, intoxication with or withdrawal from a substance can cause euphoria, ecstasy, paranoia, and severe depression or suicidal thoughts. Physical effect ranges from marked sleepiness and slowed breathing, rapid heart rate, and tremors. How do we diagnose addiction? You gather comprehensive medical, family, and mental health information. You perform a physical examination or request that the individual's primary care doctor perform one. The medical examination will usually include laboratory tests to evaluate the person's general health and to explore whether or not the individual currently has drugs in their system or has a medical condition that might have mental health symptoms. Meanwhile, in asking questions about mental health symptoms, mental health professionals are often exploring if the individual suffers from depression or manic symptoms, but also anxiety, hallucinations, or delusions, as well as some behavioral disorders. Practitioners may provide the people they evaluate with a quiz or self-test as a screening tool for substance abuse or dependence. How do we treat drug addiction? The primary goals of drug abuse or addiction are abstinence, relapse prevention, and rehabilitation. Rehabilitation is often much more challenging and time-consuming than recovery from the physical aspect of addiction. For people who may have less severe drug dependency, the symptoms of psychological addiction may be able to be managed in an outpatient treatment program. Also, you give social support, which is very important in the treatment of addiction, by helping the parents, other family members, and friends of the addicted person to refraining from supporting addictive behaviors. What are the complications, prognosis, and prevention of drug addiction? In drug addiction, there is risk for potentially grave social, occupational, and medical complications such as liver failure, pancreatitis, and brain damage. Recovery from substance abuse is usually characterized by episodes of remission, that is,